Jack, thank you for the nice introduction. Good morning, ladies and gentlemen. We will start with the Pentacam AXL financial disclosures you found we consult for Oculus. As Jack pointed out, we have expectations now, more precise measurements. The times when simply biometry was sufficient is over. I think we need to go forward. Everything is in the direction of near, intermediate, and distance visual acuity. Extensive biometry are necessary in order to get information and get the outcomes correct. Now, for precise measurements, let me correct intraocular lens power calculation needs that you have to look on the visual acuity after cataract surgery, because very often in many of these lenses, for example, a trifocal, a bifocal lens, you need ametropic results. And the two variables which really influence the IOL calculation are corneal power and axial length. I have my talk divided into three small parts here, talking about corneal power, axial length measurements, and IOL calculation with the Pentacam AXL. Looking to the corneal power, of course, you know that the keratometry has been developed early 1854 in Helmholtz times, and the keratometry only measures 4 points, which is problematic if we look just at a keratometer. Assumptions are symmetrical optical curvature with perpendicular axes. Now, it was followed by computerized video keratoscopy. You see here very the early devices, placido ring devices. That was a time, Jack, I was in the United States when you actually were developing these things with ISIS. And then we have the computerized video keratoscopy. And now, of course, we have understood that we need more information about the anterior and the posterior corneal surface. The role of the posterior corneal surface was at this time dismissed, but the small difference between the indices of refraction of the cornea and the aqueous was not possible to measure, but we could do this now. Now, how do we do measuring the posterior corneal curvature? There are devices out like the slit scanning images, Scheimpflug imaging, optical coherence tomography, and light reflection analogous from keratometry. The state-of-the-art for corneal power in IOL calculation, you can see here, very often used worldwide is the IOL Master 500. And for a long time now, also starting with the corneal measurements, the Scheimpflug device from actually Oculus, the Pentacam device. The IOL Master only measures the anterior cone curvature, and the Scheimpflug, you can see here, takes into consideration anterior and posterior curvature. We start here with a measurement of the IOL Master, taking a measurement. You can see here high astigmatic components, 3.52 diopters with the IOL Master. You can see here on the Pentacam, which gives you more information. It gives you actually, it shows the case of a keratoconus. And if you look here at the measurements, you can see that there is a difference a little bit between the anterior and the total corneal refractive power, which takes into consideration also the posterior part. The difference in the anterior surface only and the total corneal refractive power is seen here. I've highlighted the number here, 2.7 diopters versus 3.52 on the left side in the IOL Master. Now there's the next is total keratometry based on swab source OCT. As you can see here, also this technology is coming, and you see here the posterior case are taken with this device, which is the IOL Master 700. Now, if you look at biometric in cataract today, we have keratometry and laser interferometry in the IOL Master 500, only measures the anterior curvature of the cornea. Then you have next step was the Scheimpflug with laser interferometry when the Pentacam AXL was introduced, assessing total corneal power with the use of ray tracing and PCI. And finally, what I just pointed, keratometry with the swab source OCT technology. You see here the corneal power measurements, different views on the same eye with tangential, sagittal, and total corneal refractive power taken from the Pentacam device. The important thing is here total corneal refractive power map. As you can see, it uses ray tracing to calculate the power based on the principle I just explained to you. And also the principle is in this device you have a Scheimpflug tomographer. The Scheimpflug tomographer takes a picture of the anterior segment, which you see here on the right. Actually, it demonstrates here how it is done with different camera views on the anterior port, and then basically demonstrating you the Scheimpflug tomographer picture here in this particular device. The map of the anterior chamber is the whole situation we get here, and we get also total corneal power by ray tracing, as I pointed out. Now, we looked at a study, a large series retrospective case analysis with the Pentacam of 3,800 healthy unoperated eyes. We compared anterior surface astigmatism, simulated keratometry, and total corneal refractive power. This was published in IOVS. And we saw a large difference in the axis between anterior and posterior corneal surface when we had against the rule astigmatism, which is actually the picture on the right side, where all these three bars in the lower part of the slide show the situation at the anterior surface, and then we have looked at the posterior, and you see exactly on the right side, when you have against the rule astigmatism, you have patients who have against the rule, with the rule, but also oblique. So these are the ones we found out to be the more difficult to actually measure. Now, two examples, magnitude of astigmatism measurements here with the Pentacam again, looking at first the SIMK, which was in this particular case 2 diopters. IOL Master or Lenstar would have given this to you, and the total corneal refractive power, taking into consideration the posterior surface, was 2.1 diopter. This is uncritical, so the difference was only 0.1 diopter. If you look at the next case, you found here IOL Master basically giving you, or the SIMK is giving you 0.1, and you have the total corneal refractive power of 1 diopter. And now it comes to a problem of how do I calculate this or use this for my toric IOL calculation, for example. The difference is 0.9 diopters. The magnitude of the posterior corneal astigmatism, several studies have shown, and I just summarize, the mean magnitude of the corneal astigmatism posterior is minus 0.3 diopters, but that's just the mean because you have a spread of actually outcomes, as you can see on these 3 publications. The sources of error in measuring astigmatism, Doug Cook pointed this out nicely, can be crystalline lens, the posterior cornea, as we just evaluated, and of course the retina on the image maybe also be a source, but maybe we concentrate on this. The Pentacam AXL now is a device which takes into consideration corneal power and the axial length, and then it demonstrates basically a lot of different situations which you can do: axial length measurements, IOL power calculation, Scheimpflug imaging, 3D anterior analyzer, biometric, evaluation of topography, 3D cataract analysis, 3D phakic IOL simulation, different enhanced situation like the ectasia map, the Holladay map, the tomography, cataract IOL display, different indices, corneal ring display. So a lot you can just get with one information when you do basically this device, which does 100 Scheimpflug images in one scan in less than 2 seconds. So a lot of information we can basically get from here. We looked in a study the repeatability of magnitude of the axis measurement. Just to summarize, because it's a lot of information, but the Scheimpflug SIMK measured showed the highest repeatability in this study we published in the Journal of Cataract and Refractive Surgery. On another study, we compared 2 different things. I think this is maybe the most important paper here in the series I had. Axial length measurement, corneal curvature, and ACD with 3 different devices, the IOL 500, the IOL 700, and the Pentacam AXL in a prospective case series. This paper was published in the AJO journal. And what we found is basically, if you just look at the cornea, we found that the evaluation of corneal astigmatism in the upper yellow box, you find that the repeatability of corneal astigmatism measurements was pretty good in all these measurements. The arithmetic mean for corneal astigmatism showed also a very nice comparison between when you looked at the different devices by themselves. And finally, if you look at the elevation of the corneal astigmatism, we found also very good correlation. You see here the mean difference between IOL Master 500 and 700 was 0.02, between IOL Master 700 Pentacam 0.07, and between 700 and 500 and the Pentacam 0.08. So very good outcomes in terms of these measurements. The study also was looked at the axial length. We know that we have the PCI biometry. We're taking this as a standard for axial length measurement, for example, in the 500. Now, the axial length measurement with the Pentacam is integrated into the system now. And when you look at the outcome here, you can see how this is done. This is on the right side, the Pentacam AXL, which has now these two parts. You take axial length measurement and 3D scan measurements. Vertex normal is taken as a reference point. The eye motion during the image process are detected with a pupil camera, corrected during the calculation process, and a 3D model of the anterior segment is calculated then by ray tracing. Going back to this paper in AJO, what we found here that if we looked at these three different devices, and that was the first time the AXL had actually the axial length measurement, the Pentacam, we did not find any difference when you take all these three measurements. So we can use this, would not say interchangeably, but we get really the same measurement outcomes. Finally, IOL calculation. This is the IOL power calculator from this program. As you can see here, the right and the left eye, which gives you a lot of information. I just highlight a little bit here. You have the iris image, keratometry overlay for toric IOLs. You have then the toric IOL calculator print out. And I just go into an example for IOL power calculation. Now, the interesting thing is that eventually, and this is on the way, and we have actually looked at these things, that you basically have now the total corneal power, which takes into consideration in conjunction with your axial length, and you can do the calculation in one step. Here's, for example, a calculation, IOL power calculation, which looked at a toric lens, which actually then says you need a spherical equivalent of 11.5, but you need also a toric part of 1.5. So you do the measurements actually while doing one, basically one situation. Finally, the last couple minutes, three short examples. Here is the Pentacam on the left side, the IOL Master on the right side. We look at the surface, and you can see here, again, looking at the Pentacam Cataract pre-op map, which we use very often. On the left side, you see the axial display. On the middle side, you see the total corneal refractive power. On the right side, we have the corneal thickness measurement. If you look here, the total corneal refractive power was 0.7. Astigmatism on the anterior part was 0.6 diopters. There's also now a fast screening report, which most likely will be in detail explained a little bit later in the next speakers. And the example here, again, taking that picture, the AXL scan, and then you have axial length measurement, and you can go directly with your corneal information into the IOL calculation, which is done here. And the outcome here showing basically very similar results when you looked at the Pentacam AXL and the IOL Master. So the follow-up of these patients were very good, 0.7. First day, third day, post-operative, 1 week, we had a very good outcome, close to ametropia in these particular cases. Very shortly, 2-3 slides. Example, patient 2, glasses before surgery, +1, -1.25, so astigmatism. Against the rule here, visual acuity was good. You look at the right side, just the overall measurements with the IOL Master. But we looked here at the Pentacam and looked at the outcome, always looking at the total corneal refractive power, and basically then putting this into our calculations. And finally, the last example, patient 3, again a hyperopic patient, visual acuity before surgery, cataracts. You can see we use the Pentacam overlay, and then you see here the astigmatic component highly on the left side, the anterior portion of the corneas in this patient, and in the middle you see the total corneal refractive power, which also demonstrates this astigmatism. And of course, this is a very complex slide, but on the right side, I just would like to highlight you have now one opportunity to put the IOL calculation in the Pentacam, taking into consideration your axial length, your overall corneal situation, and the outcome also in this patient was very good. So in summary, when we look at the Pentacam AXL, my message is you can take the two measurements with Scheimpflug and corneal measurements, laser interferometry for axial length measurements, and we found, first of all, corneal power evaluation showed a high repeatability. Axial length, no significant difference to PCI and swept source OCT devices, so other devices which are on the market, and IOL calculation at the moment incorporates the total corneal refractive power, and with this, the posterior corneal astigmatism. And I think this is really the next step forward in IOL calculation if you want to incorporate these new ideas which have come over the last 5 years or so on our field. Thank you.